sue any state that blocks, quote, gender-affirming care for children. Now, gender-affirming care is a euphemism for chemical castration, radical plastic surgery, and other treatments for gender dysphoria. Here's one doctor trying to justify chemically castrating children. Why?
We built a multidisciplinary center that provides not only mental health support, but also medical intervention to provide relief during puberty. Why puberty? If you're transgender, puberty means that it will become harder, sometimes impossible, to look like and be seen as the gender you know yourself to be. So the question is, do you conform the identity to the physical appearance, or do you conform the physical appearance to the identity? The humane answer is to conform the physical appearance to the identity.
Oh my
So
God.
do the science people have a single long-term study showing the longitudinal effects of chemical castration hormone treatment on children? No, not one.
How about the suicide rate of transgenders?
Is one of the few people who's fighting back in an
It's over
organized way
60%.
against the Biden administration's
They don't talk
efforts to
about
make this
that.
mandatory. He's president of America First Legal. He's also former senior White House advisor, of course. He joins us tonight. Stephen Miller, thanks so much for joining us. People are kind of sitting back and watching this happen. You're not. What are you going to do about it?
So we have a lawsuit in federal court right now, and here's the core of the issue. Last week, the Department of Justice issued a threat to all 50 states saying that doctors are in violation of federal law if they don't provide gender-affirming care, which, as you mentioned, means you have to medically drug boys as if they were girls and girls as if they were boys. Now, this might have caught some people by surprise, but it didn't catch my group by surprise, because the foundation for this was laid earlier last year with the Health and Human Services Department declaring that the sex discrimination prohibition in Obamacare will forevermore be read as preventing discrimination based on gender identity. So we are suing in federal court to say very clearly that doctors have the absolute right to treat patients as the sex they actually are. You cannot force a doctor to give a male boy estrogen. You cannot force a doctor to give a female girl testosterone.
Thank you.
You cannot arrest, delay, or stop their puberty. You cannot be forced to engage in genital mutilation. These are basic things, Tucker.
How do you think that would be just normal discussion? This is unbelievable.
Just the other day, they were telling us that medical decisions were between a citizen and his or her doctor, that it was your body, your choice, and politicians should not be telling doctors what kind of medical care to provide. Weren't they just telling us that? But now politicians are telling
And insurance shouldn't be telling doctors.
Well, that's a great point. And here's another wrinkle. For 2 years,
how much they're going to get paid.
Hydroxychloroquine. You can't give them ivermectin. These have not gone through randomized controlled clinical studies for the application to COVID. Never mind, they've been around for 4 decades and the side effects are
and they're cheap to buy.
The use of testosterone to change someone's gender is off label. Doctors are being forced